Hello, I am Dr. Madhvi. I am a consultant gynec oncologist at Mallareddy Cancer Center. I am specialized in management of gynecological malignancies. In developing countries, among gynecological malignancies, cervical cancer is the most common cancer affecting females. It is mainly because of lack of awareness. So, what is cervical cancer? Cervical cancer is a cancer which develops from the mouth of the uterus. It is caused by a virus called human papilloma virus. It is acquired through sexual transmission. So, anyone who is sexually active will almost get infected in their lifetime at least once, but 90% of them will get cleared within 2 years. But in 10%, it still persists, and persistence of this virus is responsible for cervical cancer. So, what are the risk factors which are associated with cervical cancer? Since HPV is sexually transmitted virus, high risk sexual behavior is associated with cervical cancer, which includes sex at early age, having multiple sexual partners, apart from this, multiple births, and also with a short interval of time, oral contraceptive pills, smoking are all risk factors associated with cervical cancer. So, how is it diagnosed? It is diagnosed with a cervical biopsy. How do patients present to us? So, usually the most common symptom is abnormal vaginal bleeding, which can be either intermenstrual bleeding, postcoital bleeding, or postmenopausal bleeding. Some women also present with abnormal foul smelling discharge. So, any of these symptoms are very important. If you are experiencing these symptoms, definitely visit your specialist to get yourself checked, but by mere speculum examination we can catch cervical cancer very early. Once diagnosed with cervical cancer, based on the stage of the disease, it is managed either with surgery or with radiation. If it is diagnosed in the early stages, it is nearly almost curable with surgery, and in stage 2 and stage 3 it is managed with radiation. The surgical management usually includes removal of the uterus, tubes and ovaries. It's just not a simple hysterectomy, but the tissue adjacent to the cervix, which we call as parametrium, and the nodes are also removed during the surgery. So, is cervical cancer preventable? Yes, we can prevent cervical cancer using vaccines, and also we have screening tests through which we can prevent cervical cancer. Among vaccines, now we have 3 vaccines which are available. One is bivalent vaccine, which contains strains of 16 and 18. Another is a quadrivalent vaccine, which contains 4 strains 16, 18, 6 and 11. And now we have a nanovalent vaccine including 9 valencies. These vaccines are usually recommended from age 9 to 26 years of age. Between 9 to 14, 2 doses of vaccines are sufficient. After that, the 3 doses are required. Among screening tests, we have the most common is the pap smear, which is available at all clinics. Among screening tests, we have pap smear, which is most commonly available at all clinics, and a woman between 25 to 65 years of age should get themselves screened with any of the screening modalities. Now, we have a better screening modality. Now, we have HPV test, which is more sensitive than pap smear, and the screening interval is 5 years. We have a cheaper tests which are available, which include visual inspection with acetic acid. So, get yourself informed, get yourself screened and get vaccinated in order to eliminate cervical cancer. Thank you.